welcome everybody. We're here with Megan Ramos from Intensive Dietary Management.
Hi everyone.
Yeah, she's from Canada, from Toronto, right?
Toronto, yes. So
okay.
It's cold there right now.
And we're actually here in Denver, Colorado, so where it's cold also. Except
it's
it
still
rains.
nicer here.
Yeah, that's true.
It's in Toronto.
So a couple of months ago, we were talking with Megan Ramos. We had recently introduced our, what we called at the time fasting drops. It was a blend of sodium, magnesium, potassium to help people do fasting easier. We talked to Megan about it, and well...
So I'm a therapeutic fasting expert with the Intensive Dietary Management Program. I co-founded it with my goofy colleague, Dr. Jason Fung. So you might have heard of his name before. So we fast a lot of patients, but a lot of people come to us are really sort of sick. So there were some fasting drops available from Keto Chow, but they had a little bit of potassium in them. And a lot of our patients had issues with potassium levels being way too high because of their heart disease, their kidney disease, or a lot of the medications that they're on.
Well, Dr. Fung's a nephrologist, right?
Yes, so his background's in kidneys and so is mine. So we just see so many kidney patients. People from all over the world email us. And I've always really struggled trying to find the right electrolyte solution for my patients when they fast. Because electrolytes are just so critical when you're fasting to make sure that you have a safe fast and a great experience too while you're fasting. Like you want to fast to feel better. You don't want to fast and feel terrible and feel like it's some sort of punishment that you have to do in order to, lose weight and reverse chronic disease. So I've always really struggled. There just hasn't been anything available, or it had a little bit of potassium in it if it was a good supplement. So we were chatting because I've met Chris now and his team at several events, and they're really awesome. And they asked us, you guys are the fasting experts, what would you want in your ideal electrolyte solution? Now, Dr. Fung and I don't have the time or the resources or even where to even start creating our own. So I told them exactly what I would like. This is a product that would work with all of my patients, whether you're a healthy individual or you're an individual with pretty severe kidney disease and on medications that can mess around with your potassium levels. And then I got this big box sent to my house of my dream electrolyte solution for patients. So anyone who follows me on social media knows that I don't take any kickbacks from any companies for promoting their products. And since we started IDM in 2012, I've actually maybe only endorsed publicly a couple of products that have really made a big difference in my life and the life of my patients. And they're all products that I personally pay for, and sometimes I do get samples of things to try them out, not gonna lie about that. But I don't owe anybody anything. I'm only going to really recommend what's great for my patients. And since 2012, we've really struggled with electrolytes. You can have salt and you can take magnesium supplementation, but the problem with a lot of magnesium supplements in tablet form is that they're just not absorbed very well at all. And the problem with salt is that people just don't like eating salt or drinking salt. They want something concentrated that they can have that's quick and easy and that's not going to disrupt their system. And so it's always been a really big battle. Even last week I was talking with a patient and she was suffering through her fast because her sodium was so low and her magnesium. But she said, I take the supplements, they don't work. And I'm not going to eat salt because I think it's gross. I would rather suffer, and I don't want her to suffer. So I was really happy to get this box and see that there is a really great solution. And I know some people do have to be mindful of their sodium, and I really love your magnesium drops as well, because that's something that's really tough to find, good quality drops. And you go out there and you see this great packaging and advertising, and a lot of people don't know to look at the ingredient labels, or they look at it and they think that everything looks okay. But I've yet to find a product that was really amazing, either for magnesium that was well absorbed, other than Epsom salt baths, which not everyone can take. I didn't have a bathtub in my condo. I was so happy to move into a house. And a lot of our patients, they have hip issues, they're overweight, they feel uncomfortable in the bathtub, they're worried about slipping and falling. And So they're not able to do that, but we haven't been able to find the right magnesium solution for them either. So I really, really love your magnesium drops in addition to your awesome fasting drops that don't have that potassium in them. Now mind you, if you're a healthy individual and your doctor is giving you like 2 thumbs up and says that your body can absolutely handle potassium supplementation, your other fasting drops are awesome too for those individuals.
The electrolyte drops.
Yeah,
right?
the electrolyte
Because we
drops.
changed the name.
Okay.
We were trying to confuse everybody. They used to be called fasting drops, and after our conversation with you, we're like, okay, we're going to rename these. We're going to call them electrolyte drops because they're kind of the combination. It's all 3. And then the fasting drops is going to be what Megan says Megan gets.
It's really, really great. I'm really happy. Even I did get some samples from Keto Chow, and I sent a couple of them out even the other day to people who I knew were struggling. Because I get an email from a client, and they would be telling me, I ended up finding this supplementation, is it okay? And it's a popular brand, and I'm like, oh my gosh, there's so much terrible stuff in it. Like, there might be sodium, and there might be magnesium, but people usually add a lot of other junk, and you guys don't add any junk. So this is why, even talking with Jason, we're really comfortable recommending this product to our patients and to our followers.
Fantastic. Well, we're super happy to be able to help you, and you can help us, and I really appreciate your integrity and thanks so much for talking about us with this, and thanks for pushing us to make a better product.
Well, it's a great product, and I think it can help out a lot of people, like even myself included. People who have adrenal issues, getting sodium in is so important. And I've inherited really terrible adrenal glands. I've inherited everything terrible. I come from like the worst gene pool on the planet. And then just a lot of stress. Like we get to know each other a lot because we're always traveling on the road, and it just gets hectic. And I find that for me, I can't fast without sodium. But my day gets really, really busy, and to like grab the salt and mix it in with water and all this stuff. Like, you think it's only a couple minutes of your day and it's important for your self-care and to have a good fast, but people just really don't have the time. And so even a product like this, and which is good for me too, because if you do have adrenal issues, your body tends to have pretty high potassium levels. And getting those higher potassium or adding more potassium to your system can sometimes be problematic. So these drops are even something that would be really easy to help my fasting days too. So I'm actually excited about them for my own personal use, because I'm too busy to actually mix salt and water, and all the other supplements out there either have too much potassium, which isn't good for my adrenals, or they've got funky stuff in them in addition to the potassium as well. So this is a product even I'm going to be incorporating in on my fasting days.
Fantastic. Well, we like to say that it has no flavor, no sweeteners, no caffeine. It's just electrolytes.
It's just electrolytes, and it's awesome.
It's already in solution, so for those that don't know, it's made from purified water from the Great Salt Lake, which is where we're from. We're from Utah. So, because it's already in solution, you don't have to worry about bioavailability. It's just going to be absorbed. So it's
super pure, and it's in a form that's really readily available for your body when you do ingest it. So we always joke in the IDM program about supplements and how our guts are damaged, and we tend to just end up urinating out a lot of the supplements. And so is it worthwhile taking them and then just having expensive urine at the end of the day? But these electrolytes in your solution are really easily absorbed by the gut, so you're going to get a lot from these supplements, whereas stuff that's in tablet form and that kind of stuff, you're not really going to get a whole lot from them. You're going to get expensive urine, and that's not what we're going for here. You want to feel better and feel good, especially when you're fasting.
Well, one other thing that we like to point out is that because it's made from that purified water, it has a lot of other trace elements. Some of them we're not even putting on the label because it's like, well, it's just trace elements, but it's the same sort of stuff that you get from like pink Himalayan salt, but it doesn't leave dirt in the bottom of your glass. So Yeah, we got that too.
Cleaner day.
Yeah.
And those trace elements are so important, especially for us who follow just sort of the standard North American diet or Western diet. Since we started incorporating all these processed foods, that diet really prevents us from absorbing any nutrients. And those foods don't have nutrients in them to start with, but they damage our gut. So when we do eat healthy foods, we don't absorb them very well. So it's important to get these trace elements in, even if in small quantities. Our body only needs them in small quantities. Yeah. So it's why at IDM2, we encourage our patients when they eat salt to eat a great quality salt, like real salt or Himalayan salts, because there's so many great trace elements that our bodies are just deprived of too.
Okay. Well, thanks so much for joining us, Megan.
No problem. Thanks for making a product. This is going to help out a lot of our patients, and both Dr. Fong and I are really excited about it.
Okay. I got to give him a fist bump yesterday. It was great. Well, thanks everybody, and see you later.
Happy fasting.
Yeah, happy fasting and feasting. That's important.
Yes, you got to feast too.
Okay. Bye.
Bye.